A very good morning, everyone. I am Dr. Bhupinder Kumar, Assistant Professor in Department of Medicine at All India Institute of Medical Sciences, Bilaspur. Today, I'll be discussing about hypertension. So, hypertension, it is a chronic disorder, and generally, everyone would like to have a healthy and normal blood pressure. First of all, what is blood pressure? Whenever heart beats, it pumps amount of blood into the blood vessels, and the pressure exerted on the vessel walls by this blood is the blood pressure, which we commonly know as blood pressure. So normal blood pressure of a person is 120 by 80 millimeter mercury. And throughout the day, it rises and falls. There is some variation. It doesn't remain constant. There is some variation in the blood pressure. And there is a physiological dip also during the night time when the blood pressure is at a lower level. So if a person is having persistently higher blood pressure, and by definition, which is more than 140/90, that is 140 millimeter of systolic and more than 90 millimeter of diastolic, is known as hypertension. So blood pressure, basically, it is a chronic disorder, and there are some risk factors associated. The people who are having those risk factors, they are at higher risk of having high blood pressure and the further complications associated with the blood pressure. So first of all is age. As the age advances, there is the stiffening of the blood vessels because of the deposition of the cholesterol in the blood vessels, which is called stiffening of the arteries. So this stiffening of the arteries, it leads to the high blood pressure. Then the family history, of course, if a person is having a family history, the first degree relatives in the family, they are suffering from hypertension, then the person is definitely is having a high risk of having hypertension. Excess salt intake. Now, this is one of the biggest problem in now today's scenario, as because we are eating more and more of the packed food, junk food, which is containing high sodium content. It is one of the big risk factor for having the high blood pressure. So, uh, and another is not eating the healthy food. Healthy food means the food which is containing high potassium content, like the whole grains, vegetables, fruits. In today's scenario, we are eating less of these foods, so we are having a high risk of having blood pressure. Now, eating more of the processed food, definitely, I've already told you that more of the processed food, the fatty foods, they contain high sodium content because of the preservatives. So it is adding to the risk factors. Now, stress is also one of the risk factor which is associated with today's lifestyle. Stress definitely increases the blood pressure, and now in today's scenario, the cases of high blood pressure are increasing because of the newer lifestyle which we have adopted, like which is also adding to the stress of the stress in the lifestyle in the life of a person. So moving on, we can say that hypertension per se doesn't have any sign and symptoms. And I would like to stress upon this point that it is very, very important to know, because most of the patients in our OPD, when they come, they usually say that I am not having any symptoms, I'm not having any problem, any trouble because of the high blood pressure. Why should I take the medicine? Why should I take the antihypertensive drugs? So this is very important to note down here that it doesn't have any symptoms or signs, and this is why the hypertension is also called as silent killer. So that is why the early and accurate diagnosis of the blood pressure is required. And in today's scenario, usually we measure the blood pressure at office, which is called as office BP, which we measure at hospital or the clinic. Then we sometimes advise the patient to monitor or take the blood pressure readings at home, which is known as home BP. And the third one is ambulatory BP monitoring, 24 hours. We measure the blood pressure of the patient by a instrument which is attached to the arm of the patient for the 24 hours period. So this is very helpful in the white coat hypertension, mass hypertension, to differentiate the dippers and non-dippers. So these are the three main BP measurements which we take for the diagnosis of hypertension. Now, generally the symptoms, they do not occur, as I've already told you, but some of the patient may have a few symptoms like early morning headache, some dizziness, some ringing in the ears, then some blurring of the vision. If anyone is having such symptoms, then he should get his blood pressure checked. Now, the blood pressure, it is very easy to monitor or easy to measure with the sphygmomanometer. Fortunately, we have a simple instrument by which we can measure the blood pressure. Now it is measured in two values basically. One is systolic and one is diastolic. So systolic blood pressure is basically when the heart contracts, when the heart pumps blood forward into the vessels. This is called systolic blood pressure. And when heart relaxes, this is called the diastolic blood pressure. So value of the diastolic blood pressure is lower, which is 80, and the value of the systolic blood pressure is higher, which is 120 of a normal blood pressure. And hypertension is diagnosed when the person is having more than 140 millimeter of mercury of systolic blood pressure and more than 90 millimeter mercury of diastolic blood pressure. Those patients are diagnosed as hypertension. So definitely we need to prevent the development of blood pressure in any healthy person. So we need not to wait that one should develop blood pressure, then only we are going to intervene. In the healthy person also, we should try to prevent the development of blood pressure. And for that, there are few recommendations. One of that is regular exercise, then healthy diet, taking more of the healthy diet, basically the diet which is rich in potassium, quitting on the smoking, reducing the alcohol intake, stress management, and the patients who are already on medicine, they should adhere to the medicine which have been prescribed by the doctor. So let's talk about these preventive measures one by one. First of all is exercise. So exercise, what the exercise is going to do? When a person does the exercise regularly, then there is a development of the power or strength in the heart. Heart becomes more strong. So as the heart becomes more stronger, it has to generate a less power to pump more blood. So the heart can pump more blood at a less force which is generated by the heart. So the blood pressure is reduced. Second factor is that by doing regular exercise, there is reduction of the weight, and definitely the reduction of the weight, it also reduces 5 to 7 millimeter of mercury of the blood pressure. So the exercise is definitely going to add on that. Now, healthy diet, the diet which contains more of the whole grains, vegetables, fruits, which contains high potassium content, that is going to help to maintain a normal blood pressure. Then avoid the diet which is containing high sodium content. And it is also suggested that whenever we have to buy some food product, we can read the label also of the food. We can know the quantity of the sodium which is there in the food, and we should prefer buying the low sodium content foods for the eating. And definitely, we should not add the raw salt in any of the food. Suppose it is a common habit that we keep the table salt, whichever salt it is, whether it is black salt, white salt, we keep the salt on the dining table, and try to add. We used to add the salt into the food which we are having. So it is to be avoided. We don't have to add the raw salt. Then quitting on smoking, definitely by quitting the smoking, uh, uh, this not only decreases the blood pressure, not only controls the blood pressure, but it also reduces the risk factor for coronary artery disease, the cardiovascular disease. So the smoking is definitely a biggest risk factor for the development of cardiovascular disease. So quitting on smoking will definitely help. Stress management, basically it is a lifestyle management, and there are three or four factors which can help controlling the stress. Exercise is also one of them. By doing exercise, by listening to good music, soft music, then doing the meditation, focusing on your the things which you have hobby, like for example you have hobby of painting or doing some painting, singing, any hobby, or cooking for that matter, then the patient can use those activities also to reduce the stress. Now, the regular blood pressure monitoring is very helpful. The blood pressure monitoring, usually the old school thought or the old pattern was that the patient used to come to the clinic and get his blood pressure checked. But nowadays we are advising the patients to monitor the blood pressure at home also by self monitoring. So because the self-monitoring definitely is going to help the clinician also, because the clinician will be having a better idea of the fluctuating values of the blood pressure, the round the clock, or sometimes most of the time of the day was what the blood pressure is like. in the morning, afternoon, or evening, so that to decide the timing of the medicine also. So it is very important that the patient monitor the blood pressure at home. And finally the medicine adherence, that is the medicine, if the patient has been prescribed any medicine by the doctor because he is hypertensive, he should take the medicine regularly and should avoid skipping the medicine or to reduce the medicine sometimes by on his own. Sometimes the patients in our clinic, in our experience, we see that patient says that I was feeling well, so I reduced the tablet to half. I'm taking half tablet. So patient should adhere to the medicine, whichever has been advised by the doctor, and should not skip or try to reduce their dose on their own. They should take the advice of the physician and they should follow the advice of the physician. And finally, at last, I would like to uh, conclude that there is nothing more precious than having a healthy and fit body. And to maintain a healthy blood pressure in a normal range, it is very important because blood pressure is a very big risk factor for developing coronary artery disease, stroke, renal failure, the eye changes, that is retinopathy, and finally the blindness can also occur. So and as I have already discussed, that it is a silent killer. So monitoring is only tool which we have, that by monitoring only we'll be able to know which person is having hypertension and we have to manage. So at last, I would like to thank you all for your patient listening. I hope this a small information will add a lot towards the healthy lifestyle. Thank you. Thank you very much.